Welcome back to Body Beautiful. We are talking about mommy makeovers. First, let me remind you that we'll be taking your calls live with any questions you have. The phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, any advice we give you today, you certainly want to consult your own physician as well. You know, we were talking about tummy tucks, and there are different types. There's a mini and then a full tummy tuck. Explain the difference. And I think we have some pictures that we can actually roll while we're talking about that too.
A mini tummy tuck is for a woman who primarily has loose skin found below the belly button or the umbilicus.
And is that mini?
No, that one is actually a full tummy tuck.
Oh.
And a full tummy tuck is when a woman has loose skin, not just below her belly button, but she has loose skin above her belly button and has wide separation of her muscle throughout. So mini tummy tuck means, I guess another way, slightly a mini result.
Okay.
Because it's a smaller procedure. And a full tummy tuck is when, again, they have the three problems. Large amount of excess skin below and above the belly button, muscles separated, and also need a little bit of liposuction.
And the recovery time, is it different?
A mini tummy tuck is a little shorter, about a week or so. Faster recovery, they can get back to work faster, get back to their normal activities a little faster. With a full tummy tuck, it's about 2 to 2.5 weeks.
Now, I know this sounds like a bizarre question, but should a person get a tummy tuck or lipo before pregnancy or after? I mean,
yeah, so generally when a woman comes in asking for a tummy tuck and she's really hasn't had kids or hasn't really completed her family, I usually recommend that they wait till they've had their pregnancies.
Because there's no give then?
Yeah, exactly, not as much. So what would happen is if you actually did have a tummy tuck and you just had one child, you want to have another kid in 2 years, you know, yes, we remove the loose skin, but when you go to the second pregnancy, you kind of undo a lot of it.
Oh,
and so it'll be just I would say it'll be a waste. Why don't you
then
wait
have to go back
years?
in?
You may have to go back in. So I'd rather you wait and then get your family completed and then you can have everything done.
You know, a big complaint we hear a lot, loose skin and stretch marks. Can you remove stretch marks? I know some people just say, you know, you put vitamin E, you know. Is there anything that really works for stretch marks?
You know, non-surgically, it's been shown that retin-A or tretinoin can help when stretch marks are new and fresh. When they're still red, it's shown to help a little bit. But unfortunately, you really can't use it contraindicated during pregnancy and also during nursing. So it doesn't really, you know, so for those new moms, it really doesn't have much help. So there is a laser called Relume that seems to help with the pigmentation that you lose when, you know, the stretch mark becomes white and shiny. It can help, but it's only temporary. So temporarily you can gain some color and then they lose it again. So as of now, there's no permanent way of improving stretch marks. There are a lot of procedures out there that tout that they're the best at removing stretch marks. I actually haven't come out seeing any really good stretch mark removal.
You caught my attention when you were talking about retin-A because you could be treating acne or you know, lines on your face and at the same time put a little bit on your stretch marks. And
exactly. So if you're a teenager and you have some acne and you notice some red stretch marks and certainly aren't pregnant and nursing it don't have any other contraindication, you can try some retin-A.
Okay, I heard something to the effect, and we've been talking about the tummy and then the breast, but you also do the Brazilian butt lift, which apparently is catching on in popularity. Talk to me a little bit about that.
It is actually catching on like crazy. It's one of the most popular procedures we're doing now. So what it really means is that we're transferring fat from unwanted areas, and there are lots of areas that women generally don't want. They say, you know, my tummy, my hips, thighs, whatever, but they want a little more behind. They want the J-Lo look, you know, and the pseudo medical term is the J-Lo-plasty, where you actually get a little removed from the front or the thigh area and taken to the back. So it's a great way of enhancing your body with your own body tissue. It's a very natural look, soft look, and so very popular nowadays.
And this is something that lasts, or does it eventually just kind of the fat get absorbed in your body?
A majority of the fat will actually lack. It really depends on the technique that's used. The fat has to be handled very gently. That means harvesting is done different than just liposuction. So you actually harvest live fat cells and then set it aside and centrifuge it so you can get pure fat, and then that's what you transfer into the buttock area. And nowadays with stem cells being, you know, the topic being so popular, stem cells have been harvested actually from fat tissue. So when you harvest fat, you're actually transferring some stem cells into the buttock area.
Okay.
So the skin appears also better.
Doc, I don't know if we have time to take a caller here. Diane from San Jose, good morning. Do you have a question for the doctor? Diane, you're on the air.
To know if it's possible. I'd like to know if it's possible to do a a tummy tuck if you're overweight and have a lot of weight to lose in the belly area.
Thanks, Diane.
Thank you. I generally recommend for a tummy tuck as a woman be within her normal weight range. You know, about 10, 20, 25 pounds is good. If you're really, really overweight, the best idea really is to first lose the weight so you're in good health and good shape to undergo the surgery.
Okay, thanks, Diane. And we have to take a quick break, but for more information about Dr. Rajagopal, you can call her 415-392-3333 or check her out on the web at sfcosmeticsurgery.com.